Okay, thank you so much.
Hello. Hi.
Can you please raise your eyebrows?
Sanitize my hand.
Close your eyelids for me. And what I'm going to do now is I'm going to put my thumbs over your eyelids and I'm going to ask you to open them with resistance, okay? All right, thank you so much. So my patient was not able to open her eyelids with resistance, therefore her cranium
Hi,
7
this is
facial
Kimia. I'm the nurse student today. I'm gonna do the head to toe assessment for you. Is that okay?
Yeah, that's okay. So looking at my patient.
Okay, can I check your eyelids? Okay. What's your name?
Shemaya,
And date of your birth?
July 8, 2002.
Okay, perfect. Okay, do you need to go to the washroom? Okay, I close the curtain for your privacy. Okay, you're comfortable sitting like this? Okay, perfect. You're okay to start the assessment? Okay. So, her skin color is appropriate, and for her genetic background, stand up and sit back? Okay, perfect. Her height is approved and in the normal range. And okay, and her body is appropriate and symmetrical and is and proportional to each other. Okay. Okay, she has a good posture and sitting comfortable, and she's relaxed. There is no sign of distress, and she's facing towards me. Okay, and she's in a good mood, comfortable and very cooperative. Okay, she dress appropriate with the weather and fit with her body, and her hygiene is good, and she has a good eye contact with me.
So my patient's beats per minute is
Okay, could you breathe in and out?
is normal.
One more time, please.
Alright, so now
Okay, her breath is okay, and there is no sign of distress. Okay, could you please tell me who are you and where we are and what the time?
I'm Shemaya, and we're at Seneca Lab, and it's around 12 o'clock.
Okay, perfect. My patient is alert and oriented to the place, time.
inspect my patient's mouth.
Okay.
So looking at my patient's mouth.
Now I'm going to inspect your facial. Okay. The skin color is good. The face is symmetrical, and no involuntary movement. There is no edema, swelling, any lesion, any mass, and no discoloration. And
And I forgot the eyes.
and the skin texture is okay.
Okay.
So, and there is no scar. Okay, I'm gonna check the cranial nerve number 7, which is facial nerve. So could you please smile? Okay, tight your eyes. Okay, more tight. Okay, and show your teeth. Okay, perfect. Puff. Okay, puff your cheek. Okay, and puff up. I'm gonna puff up your cheek. Okay, perfect. Okay.
The first question is, do you know where you are today?
Okay, keep your eyes shut. Okay.
Okay, and do you know what
I'm going to open the resistor.
Alright, so my patient is
Okay.
alert.
Okay, perfect. Can you see? Okay, the cranial nerve number 7 is intact and symmetrical. Okay. I'm gonna inspect your eyes. Your eyebrow is symmetrical. Your eyelid is intact, and the eyelash is evenly distributed. And could you open your eyes? Okay, the sclera is white. Okay, the conjunctiva is pink, and there is no discharge in both eyes. Okay, and there is no sign of lead line. Okay, now I'm going to check your cranial nerve number 3, which is oculomotor nerve. So I'm gonna okay. Okay, I'm gonna shine some light in your eye. Okay, the pupil shape are round and rounded, and they are symmetrical in both sides. And the pupil size is the pupil size is 4 millimeter, which is normal in a normal range. Okay, the cranial nerve number 3 is intact. Check. Okay. Okay, now I'm gonna check the direct light. Okay. I'm gonna shine light in your left eye. Okay, the pupil constricts. Okay, and I shine your right. And okay, okay, the pupil is constrict too. It's perfect. So okay. So I'm gonna check the accommodation. So could you look at my tip? Okay.
So looking at my patient's head, it's proportionate
Perfect.
to the patient's body size.
Okay, when I go close to the patient's eye, both eyes are converged.
Doesn't seem to be any signs
Okay, so the pupil are constrict. Okay, and perfect. Now I'm going to check and inspect your ears. Okay, the shape are okay. The external ears are alignment and symmetrical. Okay. The earwax is color normal on both sides. Okay, perfect. And there is no discharge on both. Okay, now I'm gonna inspect your nose. Your nose is in the midline and symmetrical. Okay, no discharge and bleeding on both sides. The nostrils are open, and there is no sign of polyps. Perfect. Now I'm gonna inspect your mouth. I'm gonna start with your lip. Your lip looks hydrate and no lesion, and the color is good. So now I'm gonna check the cranial nerve number 9, which is hypoglossopharyngeal, and number 10, which is vagus nerve. Okay, could you tell okay. I can see the soft palpate and uvula is rising perfectly, and the cranial nerve number 9 and 10 is intact. So I'm gonna check the cranial nerve number 12, which is hypoglossal, and could you open your mouth? Okay, the tongue is in the middle, and could you move your tongue side to side? Okay, and say light, tight, dynamite.
Light, tight, dynamite.
Okay. Okay, so there is no sign of tremors. So it means the cranial nerve number 12 is intact. Okay, and I'm gonna check, inspect and palpate your neck. First, I'm gonna inspect your neck. Okay, the skin color is appropriate for her genetic background, and there is no scar, no lesion, no masses. Okay, and head position is in the midline, tracheal position is in the midline and straight. Okay, I'm gonna go to palpate. Is that okay for you? Okay, do you have any pain? Okay, no tenderness, and her temperature skin is warm, and there is no obvious enlarge of the thyroid. Okay. Okay, I'm gonna check. I'm gonna palpate your carotid artery. The one side at the time. Okay. This is the rhythm is regular. The strength is +2. Okay. In the other side, the rhythm is regular. The strength is +2. So on both sides is equal bilateral. Okay, perfect. I'm gonna check the cranial nerve number 11, which is spinal accessory. Okay. Okay, could you rotate your head side to side? Okay, right to left, perfect. Okay, could you push your shoulder against my hand? Okay. Do you have any pain? Okay, perfect. So the cranial nerve number 11 is intact. I'm gonna check the, I'm gonna inspect your upper limb. Okay. Okay. The skin color is okay. No discoloration. The hair distribution is normal. No scar, no lesion, and no swelling, and no edema in the joint. Okay, and no muscular art. Okay. Now, there is no involuntary movement in both hands. Now I'm gonna palpate. Okay. Right, my both palm. The moisture is okay. No tenderness. No swelling and no mass. Do you have any pain? No. Okay. And the temperature is warm. Okay. And the muscle part is okay for your age. Okay. Okay, I'm gonna palpate your radial pulse. Okay, at the same time. Okay, the rate is regular. Okay, and they are equal. Is strong. Okay, in both sides. Okay, I'm gonna count your radial pulse for 30 seconds.
Now I'm going to go to the mouth. Looking at my patient's mouth here, my patient's mouth doesn't seem to be really pressing. My patient's lips are hydrated and stay for the natural by patient's intensity. I'm going to now test cranial nerve number 9, 10, and 12. 9 is glossopharyngeal, number 10 is vagus, and number 12 is epiglossal. So for number 9 and 10, Tanya, I'm going to ask you to just say ah. It's okay. It's okay. All right, so my patient's palate
Okay.
is able to raise up and back.
It was
While it stays in the uvula,
40. It means your heart rate is 80. Okay. And yeah. Okay. I'm gonna. Okay. I'm gonna check your hands grips. It's strange. Okay. Could you squeeze my hands? Okay. The patient grip test is symmetrical. Thank you. Now I'm gonna inspect your lower limb. Okay. The skin color is appropriate. For her genetic, and no scar, no lesion, and the veins are normal. The hair distribution is normal. No deformities of muscle and or joint, and no inflammation, and no involuntary movement. Okay, in both sides, they're good. So now I'm going to palpate. Is okay for you? Okay. The temperature is warm. It means good. Okay. The texture, the skin and muscle texture is normal. Okay. No sign of the joint inflammation. Okay. No edema. Do you feel any pain? Okay. Okay, the both side is okay. Perfect. And I'm gonna check your posterior tracts. Could you wait for me? Okay. Could you lift your shirt up?
So my patient's pulse rate is 2 plus normal.
Okay, the skin color is appropriate. Okay.
My patient's pulse rate is
And there is no lesion, no mass, no scar. And okay, the thorax shape is normal. The spine is in the middle, and the scapular is symmetrical. Okay, I'm gonna palpate your back.
So just looking at my patient,
Okay, do you have any pain?
I do not
Okay,
notice
there
any
is
type
no
of
lesion, no
lumps or
mass.
symptoms. I'm going to palpate
The skin moisture is
patient
normal.
tenderness and pain. I'm gonna ask you if you feel any pain.
Okay. Okay.
Are you feeling any pain? No?
Okay, just a moment, I'm gonna check.
No?
Could you breathe
So my
in and
patient
out?
does not express any pain or tenderness
Okay.
in the upper extremities. As I mentioned,
And-
the temperature
Okay, your chest expansion is symmetrical.
which is warm.
Okay, now
There's no lesions on it.
I'm gonna escort your line back. Okay, from C7 to T10. Okay. Could you breathe?
All right, so now what I'm going to do is
I can't hear any wheezing or unusual
so now what I'm
sound.
going to do is I'm going to test your cranial nerve. I'm going to test my patient's cranial
Okay,
nerve and
it
accessory.
seems the both lung are clear.
All right, so I'm going to
Okay,
test my patient's
so
cranial nerve number 11
I'm gonna
accessory.
I'm gonna check your interior anterior tracts, and could you back to me? Okay. Okay, I'm gonna check your breath. Could you breathe regularly? Just a moment. Okay. Okay.
To shrug your shoulders up against resistance, okay? So my patient was able to shrug her shoulders against resistance. She was able to move her neck left, right, up, down. Therefore, cranial nerve number 11 accessory is intact. So back to the upper extremity. So as I mentioned, upper extremity temperature is normal. Patient has no signs of lumps, bumps, bruises, and lesions.
Okay.
I'm just going to check.
The respiratory rate is 20 per minute, and it's regular. Okay. And the quality of respiration was okay with you. Okay. So, and there is no sign of distress right now. So, now I'm gonna do the cardiovascular assessment. I'm gonna auscult and listen to your apical pulse, which is in your mitral valve, located in fifth intercostal in a space in around the left mid clavicular line. Okay, so I'm gonna count your heartbeat for 30 seconds. Okay, sorry. Okay.
No. Maybe you should just keep it. Where's your laptop?
Under in my bag or either in the bag or water.
Okay, perfect. Your heart rate is 79 per minute and it's regular. So I'm gonna check. I'm gonna listen. I'm gonna check with my bell for the extraordinary heart rate. Okay, perfect. I can't hear any extra sound such as like murmurs, so that seems really good. Okay, could you please lay down? Okay, I'm gonna cover you. Appropriate. Okay, I'm gonna check the abdominal assessment. Okay, could you lift your shirt? Okay, perfect. Okay, inspect the abdomen. So the skin color is appropriate. Okay, and abdomen is symmetry. The belly button is the midline. There is no sign of discoloration. Okay. And there is no inflammation. And okay. And there is no scar, no masses. And the your abdomen contour is flat. Okay. Okay, and I can see your ultra pulse here. Okay. Okay. Now I'm gonna auscult your pulse sound in 4 quadrant. So I'm gonna start from the right lower quadrant. So I can hear the googling, which is okay. So in 4 quadrant. So and there is no unusual sound in your abdomen. So now I'm gonna palpate your abdomen. Is that okay? Okay. Do you have any pain? So there is no tenderness, no superficial, okay. And no muscle guarding. That's really good. Okay. Okay, perfect. Okay, thank you. Could you please sit? Okay. I'm done with the head to toe assessment. Thank you for your cooperation and have a great day. Thank you.